the worst is yet ahead of us. Let's prevent this tragedy. It's a virus that many people still don't understand.
What we're seeing is organ damage all over the place.
People are dying of a disease that we do not understand. Thousands of people, old and young, and yes, there are young people dying. They are dying of a disease that does not make sense to us.
The Defense Production Act to increase swab production in one U.S. facility by over 20 million additional swabs per month.
There will be coronavirus in the fall. If we do, which we won't, but let's take an imaginary period where we say, okay, coronavirus, forget about it, we're not going to do anything about it. It will take off. That's what viruses do. But that's not what's going to happen. We are going to respond to it, to not allow it to do that.
We're bringing it to 100% of the workforce must stay home. I am not kidding about this. The numbers are going up at such a rate that, as I said, it's more than double the capacity of the hospital system. It's more than triple the capacity of the ICU system. We can't get more ventilators. I can't increase that side of the equation. I can't create more ICU beds with ventilators. The only option available to us is to reduce the spread and reduce the rate of the spread.
So let me just take a moment. We found out this morning that we lost another teammate. I would like to ask everyone to just take a moment of silence. Thank you, everyone.
Rush hour on Fifth Avenue. No one has seen anything like this before, not in our lifetime. The city that never sleeps in forced hibernation.
Last week we ran out of food. We have like around 400 people coming home with us.
In this, the land of plenty. From Queens, you can see the residential skyscrapers of Billionaires Row in Manhattan. But these neighborhoods are part of another America.
A lot of the people that are on this line, they don't qualify for any of the bailouts or any of the help. These are folks who are either undocumented or who work by the hour or by the day. And so they have no way to demonstrate a lot of the things that are required for these additional additional monies and funds or food stamps, and so they have no choice but to stand here from 5 in the morning to get food.
My wife, every morning, this lady reminds me not to quit. Every morning she says, don't quit, Pedro, don't quit.
The coronavirus crisis has really held up a mirror to income inequality in America, and especially New York. Many of the richest people simply fled this city early on and headed to their coastal and country retreats. That was not an option for the poor.
And the lower your income, the harder it is to be socially distant, with Latino and black residents dying at twice the rate of white New Yorkers who don't have the luxury of teleworking from home.
And it's so weird because seeing New York like this it's empty compared to the usual. I don't know, I want the usual.
By his own count, George Steinmetz has climbed into a helicopter to photograph New York 40 times. In 2014, George had captured this image of a crowded observatory and ice skaters.
But there were no ants today. And then you look down below Rockefeller Center, and like, the ice ring and all that stuff was just total dead zone.
6 years ago, moviegoers blanketed Bryant Park. This week, it was as vacant as the stretch of 6th Avenue beside it. Steinmetz captured the crawl between New York and New Jersey back in 2014, and then again Tuesday at 6:45 p.m.
Those guys were sent out to do that by the city, and not because it was endangering anyone, but because they didn't want people to see what was going on there.
The hardest hit New York State, the number of infections reaching nearly 250,000 people. But look at the daily hospitalizations over the last month, the curve seemingly on its way down. But officials warning it could rise again. The debate heating up on how to reopen the country.
If you want to live, you stay home. My God, don't open up this country.
New York Governor Andrew Cuomo met with President Trump.
It's the first time the two met in person since New York became the epicenter of the COVID-19 outbreak in the United States. The governor made the case that testing will be key to reopening the economy in any meaningful way.
Then I have to put together an army of tracers. That's thousands of people. It's never been done before. I'll take all of that.
Governor Cuomo says is as a group effort, announcing a tri-state operation with New Jersey and Connecticut. Former Mayor Michael Bloomberg, who volunteered to help develop and implement the program, also committing more than $10 million.
I get the pressure, but we can't make a bad decision. Frankly, this is no time to act stupidly.
The number of people infected by this rampant virus in New York State might actually be a stunning 10 times higher than we thought. Phase 1 of an antibody testing program suggests that as many as 2.7 million New Yorkers might have already been infected. But the state's current confirmed case count is just under 270,000.
13.9% tested positive for having the antibodies. They had the virus, they developed the antibodies, and they are now, quote unquote, recovered.
Wherever, whenever we open, cases will likely rise.
That number is going to go up. Those deaths are only hospitalization or nursing home deaths. That does not have what are called at-home deaths.
Move, everybody move. This is the frantic, ongoing battle to keep patients alive, even as parts of the country push to reopen.
For many of these doctors, their nightmares go beyond these walls. Those on the front lines know their daily exposure leaves them highly vulnerable. But amidst the grief, hope still lingers. After 2 weeks at home recovering from COVID-19, Dr. Paul Saunders gets a hero's welcome back at the hospital.
Thank you very much. Totally unexpected and undeserved, but thank you all for coming to work and for working so hard in all this time. So, all appreciated by everybody, but thank you very much.
And welcome back.
Happy to be back.
So this is the city's new ritual for 7 p.m., cheering on the essential workers, like the people going into this hospital.
There are some hopeful signs that the worst days could be over for the city. Hospitalizations are beginning to fall, so is the number of intubated patients. New York City's social distancing is working to flatten the curve. There's a sense of solidarity, but it doesn't look like we're going back to normal anytime soon.
Twilights last gleaming, whose broad stripes